Good afternoon, everyone. I know folks are still in line, but we're going to go ahead and get started, so continue to get your food and come back to the table. My name is Lisa Youngblade, and I'm honored to serve as the Dean of the College of Health and Human Sciences, and welcome to all of you. Welcome to our third annual College of Health and Human Sciences Research Day keynote address. In a few minutes, we'll start off with the land acknowledgement. We wanted to take a moment to just hold a space in our hearts for the people that are in Ukraine fighting. There's a lot of similarity in the work the fighting that they're doing and what we are reflecting and honoring in our land acknowledgement today. So it's especially poignant today when we play the land acknowledgement that you remember our fellow humans on the other side of the world. So I'd like to start today's program with our land acknowledgement that was crafted by our Indigenous faculty and staff and is presented in a video recognizing the long history of Native peoples and nations that lived and stewarded the land where the university now resides.
Colorado State University acknowledges with respect that the land we are on today is the traditional and ancestral homelands of the Arapaho, Cheyenne, and Ute nations and peoples.
This was also a site of trade, gathering, and healing for numerous other Native nations.
We recognize the indigenous peoples as original stewards of this land and all the relatives within it.
As these words of acknowledgement are spoken and heard, the ties nations have to their traditional homelands are renewed and reaffirmed.
CSU is a land-grant institution, and we accept that our mission must encompass access to education and inclusion.
And significantly, that our founding came at a dire cost to Native nations and peoples whose land this university was built upon.
This acknowledgement is the education and inclusion we must practice in recognizing our institutional history, responsibility, and commitment.
Thank you. Before we introduce Dr. Hasson, I'd like to thank everyone for making Research Day a meaningful celebration of the outstanding work in our academic units. Today, we're celebrating research and creative scholarship in this wonderfully complex college, discoveries that impact construction management, design and merchandising, education, food science and human nutrition, health and exercise science, human development and family studies, occupational therapy, and social work. We are improving physical, mental, and social well-being in all aspects of the human experience through advancements in science, research, and the application of knowledge. And in keeping with our proud land-grant heritage, our goal is to change lives for the better. Through the poster show and our keynote and our faculty and dean's fellows lightning talks, we have the opportunity to see example after example, after example, after wonderful example of the transformative magic that happens when brilliance, compassion, and innovation come together in our college. It's a wonderful day. And now I'm delighted to ask Dr. Barry Braun, head of the Department of Health and Exercise Science, to introduce our keynote speaker, Dr. Rebecca Hasson.
Good afternoon. It's a pleasure and an honor to have Dr. Rebecca Hasson join us today. Dr. Hasson serves as Associate Professor in the School of Kinesiology at the University of Michigan. She is also the founder and director of the Childhood Disparities Research Laboratory, as well as the director of Active Schools and Communities. Her research is centered on the development and implementation of physical activity interventions in school and home environments, especially for low-income and ethnic minority pediatric populations. Dr. Hasson is the principal investigator of the Interrupting Prolonged Sitting with Activity, or IMPACT study, where she and her team rigorously test the value of adding activity breaks in classroom settings. She adapted the program for dissemination in the home environment during the COVID-19 pandemic. Dr. Hasson is also a member of the Board of Trustees of the American College of Sports Medicine and the chair of the Strategic Health Initiative for Health Equity. But all these things are in her CV. So let me tell you 4 things that you will not learn by reading her CV. 1, Rebecca's commitment to health equity, diversity, and social justice far predates our current fascination with DEIJ and goes back 20 plus years to when she was a student and has never wavered. 2, Rebecca operates under the highest ethical standards in everything she does. No shortcuts, no compromising on core values, and no tolerating of bad behavior. 3rd, Rebecca brings her A game to everything she does, including this visit, and she expects no less from anyone who works with her. So just as a quick example, we were having dinner last night. Rebecca and I were sitting at the table, and in short order, at one point, Dr. Braungart-Riekert and Dr. Bright walked in separately. Rebecca recognized them from across the room before I did, because she had done her homework on who she was having dinner with. And 4, Rebecca is one of the most optimistic, well-rounded people you could ever meet, with almost boundless joie de vivre, which I think will come through. With that, I will get off the stage and let Dr. Hasson, as Dr. Don Quixote would say, instruct and entertain us with her talk, Merging Implementation Science and Health Equity Research to Eliminate Youth Physical Activity Disparities. On behalf of the College of Health and Human Sciences, please help me welcome Dr. Rebecca Hasson.
Thank you, Barry, for that wonderful introduction, and thank you all for being here today. One of the characteristics that Barry or Dr. Braun forgot to mention is I also have a little Don Quixote in me. So much so that at my dissertation defense, there was a quote read from the book implying that I was crazy doing the type of research that I do as it relates to health equity. And even as you look at the title of my presentation today, you might think I'm a little crazy because I didn't say reduce health disparities or reduce, I said eliminate youth physical activity disparities. And when you think of all the problems that our children are facing today, yes, it may be kind of crazy to take those problems on. But with my sword in hand and my students behind me, we are trying to fight that battle, and I know we're not doing it alone because many of you are fighting that same fight with us. So today I'm going to tell you just not only the successes that we've had, but particularly for the students in the audience, the failures. The Don Quixotean failures, to where we did not think it through all the way, or we thought that we could just solve these problems very quickly with one quick intervention, but how we learned from those mistakes, how we were transparent with those mistakes, and how we moved forward, finding different areas of research, different collaborators to really make a dent and try to get the world moving again. So as I start, here's some of the bad news. And this is why it's a little quixotic to think that I can even do anything about it, because as we know, we've been in this COVID pandemic for the last 2 years, and we've been thinking about masks, we've been thinking about vaccines, but we haven't had as many conversations around the unintended consequences that the COVID-19 pandemic has had on our children. And here is just to list a few of those statistics. 2 years ago, we were projecting that there would be a negative impact on our students, on our children, on our adolescents in our communities, and now we have the actual data that is confirming that. So we know that screen time has gone up tremendously. It actually doubled in our adolescent population. We know that one of my colleagues at the University of Michigan published in JAMA that childhood obesity went up by 9% in 1 year. When we think about education, the academic achievement gaps, digital divide, it was already there before the pandemic, and it expanded even more during, and we're still trying to battle our way out of that academic or achievement gap. We know that depression and anxiety has gone up. It's gone through the roof. We know that 1 in 4 children across the world globally is experiencing symptoms of depression, and 1 in 5 children are experiencing symptoms of anxiety. And then we can't forget the trauma associated with actual parents dying from COVID. So we know the stat that was at least 6 months ago that we have, at least in the United States, 170,000 kids who were orphaned as a function of this pandemic. And that's not even globally. So these are huge, huge, huge problems that we are dealing with, and we're trying to be on the road to recovery and thinking about how can we build resilience. And as an exercise physiologist, again, these seems like overwhelming problems. But the cool thing about exercise, regular physical activity, is that there are multiple comprehensive benefits of physical activity that can actually touch on many of these problems that I just mentioned. When we think about coping strategies for our students, when we think about social emotional skills, when we think about intellectual capital, we know that kids who exercise regularly, those high fit kids, they actually learn better. They test better on academic standardized tests. We know that if we put physical activity in the classroom, that the kids will actually be more attentive. They will have increases in focus and attention. We know from the physical education literature that we have always been able to increase social emotional outcomes as a function of moving more. So there are multiple benefits with regular physical activity, and that is where I have been working for the last 15 to 20 years. When we think about what are the physical activity opportunities available, this was a wonderful review that was published by David Bassett a few years ago. It was commissioned through the Robert Wood Johnson Foundation, and it focuses on what works to get kids active. And we can see here that, of course, PE is the #1 thing that can help to get kids active, but a lot of schools, they do not have daily PE. And if we think about low-resource schools, they may not have PE, and they also may not have certified PE instructors. They may not have gyms, so there's a lot of barriers to implementing a policy of required daily PE. The second best thing, though, is activity breaks in the classroom. So we know that all kids spend the majority of their time in schools in that space, and so can we get some more physical activity in that space? Thinking about renovating parks, after-school programs, walking to and from school, these are also great opportunities for physical activity. But again, depending on the neighborhood you live in and depending on the resources of that neighborhood, you may not have those opportunities. And with the COVID pandemic, all of these opportunities shut down. So again, we were all in virtual learning spaces, and so there was no walking to and from school. There was no playing in the parks. There was the after-school programs, many of them were either closed or went virtual, and again, PE became virtual. But we have been working in this space of classrooms because even though school went virtual, this is still an opportunity to integrate physical activity in that space. So we created the program about 5 years ago. It's called Interrupting Prolonged Sitting with Activity. And this is Mr. Reyes, and so we train teachers on how to effectively integrate physical activity into that space. Because most kids go to public, even private or charter schools, they are in that classroom. It doesn't matter if they have PE or other forms of physical activity opportunities. This was one way that we could provide equal access to all kids if we can put that physical activity in that space. So what did we find? So here are just the preliminary results from taking impact, putting it in the classroom. And we have actually been able to get 20 minutes of physical activity in that space, which is 1/3 of the physical activity guidelines for children and adolescents. We were able to, the stat that teachers love the best is that 99% of children were back on task after doing an activity break. So when you talk to elementary school teachers, they think their classrooms are gonna look like kindergarten cop. If you actually introduce physical activity, that the kids are gonna be running around like chickens with their heads cut off. But no, actually, activity breaks help kids to become more focused and attentive. And so that was a big selling point for teachers. For the exercise physiologists in the room, as we measured physical activity intensity, 85% of the kids were exercising at a moderate to vigorous intensity. And we could there was enjoyment of activity, and the kids really boosted their confidence in their ability to be able to get at least 30 minutes of physical activity at school. So these were great results as we were going that, yes, we are doing something. We're getting more physical activity in the classroom. And this is not new. Activity breaks, we've been doing that for maybe 30 years. And if you look across the United States, over 43% of schools are already implementing some form of physical activity in the classroom space, particularly in the elementary school classrooms. Go Noodle is pretty prevalent. I just learned from teachers the other day, they like these videos called Chase, or what you would do, or this or that. There's all these different kinds of exercise videos. So many teachers are doing this. The problem is that they are not doing it consistently, and they are not doing it with fidelity, and many schools, low-resource schools, are not doing it at all. So we have inequities or inequalities in terms of how it is being implemented. And if you have programs, one classroom's implementing one activity break, whereas other classrooms are implementing 4 or 5 activity breaks, that's a difference in about 15 to 20 minutes of health-enhancing physical activity. Maybe that doesn't matter for one day, but if you look at it over weeks, over months, that can have tremendous differences or impacts or inequities in health and social-emotional outcomes. So what are we going to do about that? So one of the things that we did was actually investigate it. Are these differences, where are these differences coming from, and how do we actually intentionally try to overcome them? So when we looked at that, one of the things about being a health equity researcher is to be intentional about making sure that you implement in different resource schools. So in that first study that I just showed you, we made sure that we had a high resource, middle resource, and low resource school. And here's the demographics here. You can see they're all about the same size, but they had difference in terms of 2 of the schools were predominantly white, 1 was predominantly non-white, and then they had different academic standings. So one of our schools, they ranked 16 in the 16th percentile based on their academics, versus the other 2 were much higher in the state. And then you can see differences in the percentage of students who qualified for free and reduced lunch. So Lexi, my Ph.D. student at the time, this was her master's thesis, actually disentangled all of the data. So I said we were able to get 5 activity breaks, which equated to about 20 minutes of physical activity, if you look at all the data together. But if we divide it up by each school, we see that, yes, there were differences in implementation. The middle-income school, yes, they were actually almost able to get 6 activity breaks, whereas the low-income school was only able to get 3 activity breaks. We see in terms of student intensity, so how hard were they exercising in the classroom? We see differences here by the different type of school that was implementing the activity breaks, to where it's this nice stepwise approach to where the kids that were in the low resource school were exercising at a lower intensity compared to the students at the high resource school. Same thing with enjoyment of activity breaks. Now, you would think everybody likes to enjoy these activity breaks, but no, it was small, but it was significant to where we saw differences in enjoyment. And any teacher knows if a kid doesn't like to do the exercise break, they're not going to do it. And so if it's not fun and enjoyable, that's one of the #1 predictors for physical activity engagement, and so we needed to overcome that barrier. And then finally, probably one of the biggest barriers was transition time. So as an exercise physiologist, you might not care. You're like, well, what does that mean, transition time? This is getting a kid from the seated position up into a standing position to do the activity break. If it only takes a teacher 1 or 2 minutes, 30 seconds to a minute to get the kid up, then that activity break is only going to be about 5 minutes. But if it's taking 2 to 3 minutes because of student behavior to get the kid up, do an exercise break, get the kid back down, that's now turned into a 10-minute activity break. And time is the biggest barrier for all teachers. So in looking at these results, yes, overall, we had great outcomes. But when you disaggregate it and look by resource levels and barriers at different schools, we recognize that we were actually creating disparities in implementation that were then creating disparities in our outcomes, our physical activity outcomes. And so this is one of the mistakes that we made. We thought we had this great intervention that was going to solve all of these implementation problems, but it didn't. It actually, to some extent, exacerbated them to where we had an equality-based intervention to where we gave the same professional development, the same resources to the schools, but disparities in outcomes. And so we needed to take an equity-based approach in order to provide unique resources, tailored resources, additional resources for schools that need them so that they too, their children too, could reach that 20-minute physical activity threshold goal that we wanted for all of our schools. So how did we do that? That's how we got introduced to the research or the area of implementation science. So implementation science really looks at what are those barriers and facilitators to implementation? What is preventing a teacher from saying, or contributing to a teacher saying, no, I'm not going to do the activity break today. There's too many things going on in the classroom or in the school or in the district at this time. So how did we look at that? We used implementation science frameworks that have been shown to how do we tailor, how do we adapt our intervention to really meet the needs of the teachers in those different areas. So using REP or replicating effective programs, we came up with different implementation strategies that were used or developed with teacher input that can then help the program to be more flexible and to help it be more, be implemented with increased fidelity, implemented the way that we had designed it to be implemented. So what were some of those barriers that we noticed? Well, we noticed that, again, competing curricular challenges. So because the school that we were working in were considered low in terms of their academic performance, the curricular challenges were huge. And so how are we going to get around that, or how are we going to work with the teachers to really focus on helping to get their academics up? Limited resources. There wasn't that much time for training the teachers on how to effectively implement activity breaks. There were perceptions around student behavior, and also communication between principals and teachers was low. In one of the schools that we were in, the principal didn't even know that we were in their school until the TV cameras came and we were shooting a commercial about physical activity in the classrooms. They were like, hey, who are you guys? That just shows you how the low level of communication that a principal didn't even know that we were in their schools. So by creating these different implementation strategies, it enabled us to create more supports and more technical assistance to the teachers. And so what did that look like? That looks like our impact coaching model. So instead of framing this as another physical activity program, because again, if you go into schools right now with another program, teachers will roll their eyes, they might even get up and walk out because they are so overwhelmed and there's so much things being thrown at them that really it was more about a conversation. We reframed how we were having a conversation about physical activity and focused on how can we help to support them with what they are already doing. Again, many teachers were already implementing activity breaks. We wanted to meet them where they were to provide them with more supports, give them technical assistance, help them to increase their confidence in their ability to overcome any sort of obstacle that they may have with implementation, and provide opportunities or strategies to increase student motivation, classroom management, and curricular integration. And so all of this was packaged in a program guide, and then we also have many different resources that are freely available on our website. So I'll show you a few, but if you go to our website, we have them all listed out, and from floor plans to classroom management strategies to different types of activities to videos and training videos so that teachers can watch them on their own, and we don't have to travel all over the state trying to train teachers, but they can do the PD on their own, professional development on their own. So when we think about classroom management, since that was a huge barrier, How did we help to overcome that? Well, one of it was making just these simple little posters that talk about move and focus. So each teacher would put into their classrooms these acronyms that would help the students know when it's time to get up, when it's time to sit back down. For the exercise physiologists in the room, we would also put heart rate posters in their classroom so that they knew that kids knew if they were exercising at the right intensity or not. And they would be taught, how do you take your heart rate? And the kids loved it. And this is what contributed to, as we have replicated it over time, the 99% of students who were back on task, because right after you're doing an activity break, we would have them do their heart rate. Are you in the zone? Then they would get back and they would be nice and focused and attention on what the teacher was saying. And these posters were created by an undergrad, Molly O'Sullivan, she's the one who came up with the different acronyms and what those acronyms meant. And the teachers who were using the posters, using these behavioral management strategies, actually had much greater improvements in implementation. For my architects in the room, many of the teachers did not have, they perceived that they did not have enough space in terms of being able to safely implement physical activity in their classrooms. One of our classrooms in Detroit, the teacher had 44 sixth graders that she was teaching, and so there was very little space. Won't say the school because it was probably a fire hazard, but there was a lot of kids, big kids, in the classroom. So the teacher was very nervous about how are we going to be doing jumping jacks or whatever kind of activity you want me to do when we don't have space. Now, if I had you all get up and do an activity break, you would nicely be able to go to a spot, but make sure that there's enough space around you so that you're not hitting anybody. That is not the case with third graders, fourth graders, and fifth graders. They actually like to bump into each other, so we had to create different, not only behavioral management strategies, but also some of these floor plans. So we worked with an architect who went to each classroom, or went to many different classrooms across the state to get the measurements to see how much space is a classroom, how much space is in there, how many desks do they typically have, and then created these different floor plans. Those little funky little drawings that you see, they also did these simulations in the studio to see how much space does a child actually need. Third grader through sixth grader, they need about 36 to 48 inches, and so you could create these floor plans that would allow for each child to move safely. And I think that teachers like the architects better than they like the physical activity because they thought it was like HGTV where the architects were coming in and redesigning their classroom. But they really liked the ability to have more space in their classroom, which was a huge barrier that was reduced, particularly in our low-resource schools. And then the final one, how are we going to get student motivation up? So the kids, again, like I said, if a kid doesn't want to do an activity break, there's nothing you can say or do to get them to move, except stickers. Now that seems crazy and funny, but we were reading papers, and this is why you have to listen to your students. Professors, listen to your students, because your students are crazier than us, right? And so they have these crazy ideas, and they have more Don Quixote in them than we do, but they read papers about game design and gamification, and that this is used quite a bit in the educational setting. And so what does that mean? It means you're applying different game elements to the intervention. So allowing the classrooms to work together for a common goal, giving them points or stickers to increase their physical activity, and then maybe there's a reward at the end. So I said, nope, it's never going to work. The students said, come on, please, can we try? I said, fine, it's not going to work anyway, so go ahead and try it. They added in different components. So again, they had a block M that they would give each. If they met their goal the very first week, each classroom would get a trophy. If they met their goal the next week, then they would get another sticker. And if they got 6 out of 7 stickers, then they would get an impact activity extravaganza. What is that? More physical activity. That only works with kids, that you can incentivize physical activity with more physical activity, but the kids loved it. They got a field day at the end, and as you can see on the left-hand side, that is the first few weeks, or the first few bars is just the standard physical activity. How many kids were actually exercising without the gamification? And then how many kids were exercising when we added in these game design components? And we saw a 27% increase in the kids who were exercising at the right intensity. So your students are crazy, but they're right, so listen to them. So when we went back into another school, did this coaching model work? Did all of these different strategies work? They did. And so we were in low resource schools, and in the 3rd through 5th grade teachers, they were able to actually get 21 minutes of physical activity. And so we were doing the happy dance. We no longer had to cry that we were creating disparities, not reducing them. And so now we have a smorgasbord or buffet of different types of resources and supports that we can offer to different teachers across the state. So again, I always have to honor my exercise physiologist in the room. Is that 20 minutes, is that even enough? I thought you said we're supposed to get 60 minutes of physical activity a day. Well, there is research that suggests that yes, 20 minutes is sufficient. It's not as good as 60, it's not as good as 40, but 20 minutes you can get cardiometabolic improvements with 20 minutes of physical activity. So that is really exciting for us. I had to give a presentation at the American Diabetes Association. I presented first, and then this author presented. I was like, yes! It was a great combination of what is the lab saying, and then how are we translating that out into the community. Another piece that I just want to quickly mention is thinking about, okay, well, what about social emotional regulation? And in the state of Michigan, we have a lot of social emotional curricula that is being used, but one is focused on zones of regulation. So what is zones of regulation? This is actually, in each of the classes, particularly in elementary classes, students will identify which color they are feeling, and that relates to different emotion states that they are in. So the teacher will ask, okay, pick your zone. Which zone are you in, or which color are you feeling? And the student will say blue, which means it's sad, bored, tired, or sick. They're in the green zone, happy, focused, calm, proud. Yellow zone, worried, frustrated, silly, excited. So they might be bouncing off the walls a little bit. Or the red zone, they also might be overjoyed, elated, or they're panicked, or they're angry, or they're terrified. So if you're thinking about a classroom, which zone do you think a teacher wants their child in for learning? It's the green zone. So thinking about, it's good to have self-awareness about where you are, but are there ways in which we can help to transition kids, acknowledge where they are in the red zone, or the yellow zone, or the blue zone, but get them into the green zone to help them be focused and attentive for work? And my new Ph.D. student, Penelope Friday, she was a former childhood obesity coordinator for the state of Indiana. She's actually working on this. How do we connect physical activity to emotions? Here's one example. So she's developed over 200 and probably close to 300 play cards now. They're kind of like Uno cards that teachers can use or that parents can use, and they connect emotions with physical activity. So if a kid is feeling tired, maybe they can do clapjacks. So what are clapjacks? There's a thinking or a cognitive component along with exercise. So we're helping to arouse their thinking, helping to get that BDNF flowing to the brain, helping blood flow to increase, and that might help to energize them a bit more to get them into the energy zone. Now again, I'm the exercise physiologist, so I'm interested in what's the mechanism of how these might work, and so those are some of the questions that we are asking. But the literature does suggest that over time, if kids continue to use physical activity as a coping strategy to manage their stress, manage their emotions, that it will help them to build resilience over time. If we look at these are CASEL competencies, which is a social emotional curriculum, that as they are engaging in physical activity, as you're having conversation around building social emotional skills, as you're working in teams, doing buddy activities, this can help kids enhance their self-management, their self-awareness, decision-making. So even working in classrooms where maybe not everyone is doing the same activity, but in that corner we're doing jumping jacks, in this corner we're doing more mindful activities, in this corner we're doing, bear crawls, and in this corner we're doing something else. But that kids can self-select where are they and what type of activity do they need to get back into the green zone to have greater focus and attention in that classroom. So those are some of the things that we are working on. And what is really cool is that one of the classrooms or the schools that we're working in, they've actually been measuring zones of regulation. So kids 2 times a day since 2019 have been measuring where are the kids at and what strategies are they using to get back into the right zone. And so we have pre-pandemic, pandemic, still kind of pandemic, second phase of pandemic, and then once we've added in activity, and do we see any natural changes over time? We definitely know that during the pandemic, many of the kids were in the blue zone. Like they would report that they're in the blue zone and they didn't really have many strategies to help get them into the green zone, even when they were at home doing their schooling at home. So can physical activity be one of those things to help them self-regulate, self-manage, and get into that green zone and stay there? And it's an important caveat as we're talking about the classroom. It is not bad to be in the red zone. It is not bad to be in the yellow zone or the blue zone. But when we're thinking about learning and instruction, seated instruction, it is important that we try to get the kids into the green zone for that learning space. But in general, we're going to be in all these different zones all throughout the day. It's how we manage those different emotions. So thinking about sustainment and implementation. So this is the second mistake that we have made, is that we have spent so much time focusing on the intervention and making it the perfect little intervention that it was awesome and now everybody can do it. We have not spent a lot of time on the context in which the intervention is being implemented, because that has such an important role. It's not just about having this cool bells and whistles intervention. What are the barriers, the organizational barriers? What are the system level barriers in schools that would prevent a teacher from being able to implement an activity break? So we had to go back to implementation science to look at, is there a process that we can follow? Are there frameworks that we can use to help us understand what do we need to have in place before we even take the intervention into the schools? Because many superintendents will reach out to us and say, we want impact in September. And that's great because they see that the need is great. But what is in place in order for that intervention to stay there so that it's not just there for one semester, 1 year, and then the next year they're on to something else? It's a new big shiny object. No, let's think about what can we put in place to make sure that this intervention is sustained. And so the EPIS framework is what we currently use. It's called the Exploration, Preparation, Implementation, and Sustainment. And it really talks about, okay, in this exploration phase, what is even the need for impact? It sounds cool, we got commercials, it looks nice, everybody knows physical activity is good for them, but does this school district actually need impact in their schools? Their teachers may already be implementing 20 minutes of physical activity, or they may have a ton of physical activity in their school districts. Is this really what they need? And if it is what they need, then you go to program adoption, make the decision to adopt the program or not. But even then, you still don't implement yet. You move into a preparation phase. So in that preparation phase, now you're starting to plan. What does the planning look like in terms of how do we build out different supports, not only for the teacher, but at that organization and system level, and then you implement. So we like to call it the slow roll. And so, a lot of people, the teachers love the slow roll. The superintendents, not so much. But we want to make sure that it is sustained in the schools. Because again, normally we just start right there at that training, train the teachers real quick, and then start implementing. But once we leave, what's the sustainability model? Is there a training of trainer programming in place? What do the physical activity policies demonstrate that there's something that is going to keep this program going? Because there's so much teacher turnover. Even if we were to train the teachers this year, half those teachers may be in another school district, retired, quit for whatever reason. You need to have these things in place from an equity lens, particularly for our low resource schools where there's 2 or 3 times more turnover. That's very, very important. So there are no blessings in the COVID-19 pandemic, but there were opportunities for us to practice the pause, because we were going to implement immediately in a low-resource, low-active district. But in that year where everything was shut down, we were able to examine the exploration phase, go into the preparation phase to make these supports so that we can have district-wide scale-up. So what did that look like? So Amy Wassman is the regional school health coordinator that I worked with, and she and her team at the schools, we weren't even present for these evaluations, but she used what's called the hexagon tool that actually looks at 6 different components of an intervention and to see if it fits into the needs of the schools. So is there a need? Is this an evidence-based program? Does it fit in the school? Is it usable? What's the capacity of the district to sustain it? And are there any supports available? And the first time that she did this, it was literally 2 days before the pandemic started. We got a 19 out of 30. So not bad, not good, but not bad. But as we worked together and built the support, she actually did the evaluation again, and our number boosted up to 28 out of 30, meaning that the intervention fit really nicely with the context, and there was broad buy-in from the district that yes, we should be implementing impact. And so we needed to take that time to do a basic evaluation to see, is this actually going to fit, and what do we need to do beforehand? So why did we have such a low score? Or what were some other things that were contributing to it not being quite ready? Looking at their policies, so their physical activity policies. So everybody knows every district, if you are getting federal funding, you have to have a wellness policy. And that wellness policy dictates what you are doing or encouraging in your school districts. When we looked at the district that we were in, or the intermediate, the region that we were in, they were much lower than national standards in terms of their comprehensiveness and the strength, meaning that they said they were strong in PE, but all the other types of physical activity, it was either non-existent or they really didn't say much at all about it. And there was no language in there about classroom activity breaks at all. Throughout the entire region, there was no information about classroom activity. So if we just added 2 statements to their policies, we will provide professional development training for your teachers. Teachers shall implement 5 to 10 minutes of physical activity every day in their classrooms. This would dramatically increase their policies, and this would also help with the sustainment of the program beyond the initial training phase. We also developed during this time a training of the trainer program. So what is that? It's where we train the regional health coordinators, and there's regional health coordinators all throughout the state. So we have, through our state funding, we have individuals who are in charge of implementing or training teachers on the state health curriculum. And so now they are being trained on impact and all of the different resources so that they can then train classroom teachers, as opposed to me getting on my tour bus and going all across the state to train different teachers. So Amy was trained, and so now she's training everyone in her district and in her schools. And because there are regional health coordinators all throughout the state, we have an opportunity to touch many different schools, all of the public schools in the state, because of this regional health coordinator system that we have. And through Michigan and the Michigan Department of Health and Human Services, they have also asked that the impact at school resources be incorporated into their state health curriculum. So this is another state sustainability piece, that if these resources that we have are in the state health curriculum, and we have individuals who is their primary job to distribute the state health curriculum, that is part of the training of the trainer model that we have in Michigan around getting impact into every different school. So by taking that time during the pandemic to really wait or build out all of these different supports at all of these different levels, we have a much greater opportunity for success in implementation once we actually get into the schools, and not just in one school here, one school there, but looking at entire districts, entire regions where impact is being disseminated. But then COVID hit, right? That sounds great. And then COVID hit. And so what are we going to do? Kids are at home. What are you talking about schools for? There was already all these different challenges with physical activity before COVID, and they increased dramatically. Like our schools were closed. All of those different opportunities that I talked about before were non-existent in many of our schools. So I had the vice president of the State Board of Education, she reached out to me and she said, I know you've been working in schools for a long time, can you help me get kids moving? And sarcasm is not a virtue. It is not a virtue. But I said to her, I was like, well, can't you just turn on an exercise video? Like, this isn't rocket science. And I shouldn't have been smart. But she was like, that's a great idea. I'm like, what is it? And the next thing I knew, I'm on the phone with the state superintendent trying to figure out, like, how can we make physical activity accessible through videos during the pandemic? And for those of us who exercise, we've been doing this for quite some time. So it didn't seem that novel, but in a time of a pandemic, it was a very novel idea. But we did not have the time or the resources or the money to create a new program. So what can we do when we only have 2 or 3 months to really get a program up and out across the state? And that's where implementation science came in again. And so we used the rapid cycle research frameworks that helped us to identify what are those different pressure points that, what do we have, what's the problem, who's the partnering organizations that we can work with, how are they tackling this problem, how can we find the simplest solution so that we can get it out as quickly as possible. So let me take you through this quickly. But when this first happened, and of course when the Vice President of the State Board of Education calls you, then you get a lot of buy-in from a lot of different organizations, and it was a pandemic, so people were very willing to want to work to help to overcome this problem of physical inactivity. So we were able to work with the health coordinators, the Detroit Lions, the Detroit Pistons, the PE organizations, the Michigan Elementary and Middle School Principals Association, because everyone wanted to get kids moving again. I used my resources at the American College of Sports Medicine, and we kind of pooled our expertise to figure out, okay, how is this pandemic actually affecting communities across the state, across the nation, across the world in terms of physical activity? What were those key points that, why is COVID-19 influencing physical inactivity? What's the connection there? And so we were able to go to the literature and understand what the problem really entailed. Knowledge exploration. So then again, going with all of our program partners. So thinking about gyms. How were gyms tackling this problem of physical inactivity? What were the PE teachers doing to help tackle this problem of physical inactivity? And then from there, what's the simplest solution? So what we decided was to take the results that we had in the classroom and then translate that to the home environment. So we knew we could get 20 minutes in the physical activity in the classroom. Can we get 20 minutes in the home? We knew that kids love exercising with their teachers, and so can we have teachers develop exercise videos that they can do, the kids can then do in their home? PE teachers were already kind of doing this. Fitness facilities were already kind of doing online physical activity. So instead of distributing this through schools, we just used the brand of Michigan Media to put it out to the state so that it would be widely disseminated. And that's what we did with no money. We had no funding, we had nothing. We just had big hearts from all of our PE teachers from across the state who pulled out their phones, developed physical activity videos, and then we posted it on our website. And within 6 months, we had a very wide reach of the program. So people all over the world were actually accessing these videos. And by the end of 6 months, we had at least 48 states that were watching the videos and 2 US territories and 27 countries from the Google Analytics data that we had. But we still weren't reaching all of the different children because in Michigan, remember that digital divide that I mentioned earlier? You have to have internet in order to access online videos, right? Well, a third of the kids in Michigan do not have internet access at home. So here I go again, creating disparities in physical activity opportunities. But we had an opportunity to apply for COVID CARES funding, and this gave us $1 million. And through this, we were able to, again, partner with the Michigan Department of Education. We were able to partner with Detroit Public Television, and the PE teachers went into the studio, created these different videos that are now being broadcast on public television, which reaches 98% of households in the state of Michigan. And their current viewership after a year is 500,000 views per month. And that's just in the first year. And so that is super exciting that now we do have an opportunity to reach all children across the state, even beyond the pandemic. So many schools are back in person, but it's still an opportunity for us to help families move together through physical activity just by putting it on TV. And so that's how we came up with Impact at Home. And so these are some of the videos where they have different, it's nice because the PE teachers would bring in their children or they'd bring in their aunties, uncles, cousins. So it really was a family affair. And we even got the Detroit Lions to do some of the videos so that kids love Rory, even though we can't win a football game to save our lives. But they love Rory. And so that was a great motivator for people to watch the videos. In addition, for all my social workers and psychologists in the audience, we also didn't just want to get kids moving at home, we also wanted to engage in conversations. So we knew that family members were having more time together at home. And so can we take advantage of that by actually having them move together, think together, and be together? And so we developed all of these different family engagement modules that talk about resilience. They talk about managing stress. They talk about feeling good with exercises, the foundational behavior to build that activity. And then we just released yesterday health choices. So our world seems very out of control right now. Seems like we don't have any choices. We can't, all the choices are being made for us. But one thing we can make a choice about is physical activity. And so making a plan about how can we stay active or start being active even in a time when we feel like we have no control. So we've made 9 modules so far. They're all freely available, and that was with all those pictures that you saw of the individuals. Those were different experts in areas of child development, school psychology. I know exercise, but I don't know the other stuff. So partnerships is huge in terms of trying to help to promote family conversations and connections. And all of these are on our website. And one cool thing that we learned from the school that is also translated into the home environment is that we have gamified the website. And so each time a kid completes or a family completes an activity, they get a nice little trophy. And so we're trying to work with different sports agencies to provide different awards so that maybe they can go down to the Ford Field and see the Detroit Lions playing, or maybe they'll get a free opportunity to be in one of the football camps, or partnering with libraries. It's now March, it's reading month, and so maybe there's different activities that can be provided. And so thinking about how can we bring in the community to help foster more physical activity, not only in the school, but also with families as well. And because we are researchers, yes, we love community programs, but we also want to ask these questions and continue to build the evidence for the Impacted Home program. So Lexi is also, again, evaluating the quality of the exercise videos that were developed. Is the cognitive load low enough to where students are going to engage in it? How are they feeling? What's their mood after each activity? So far, if you had the top 4 words of doing the different Impacted Home activities is tired, sore, energized, and happy. So we'll take it, right? We'll take it. So people aren't used to exercising at home, and so they're tired at first, but hopefully over time, she's going to be looking over and giving them a monthly calendar of activities to do and rating how they're doing, how many calories are they burning, and things of that nature. Looking at the barriers and facilitators. So again, just because it's accessible, not all homes are the same. So what are the barriers? Why might some families be able to do it totally fine, other families not so much? And are there, again, additional supports that we need to add in that allow for more physical activity, equitable physical activity at home? And then again, are these modules that we've developed, are they effective? Are they helping to improve resilience? Are they helping children to feel good? So understanding what is the evidence base behind these different resources that we have created. And in the meantime, similarly, there is alignment with the state health curriculum. So they're taking the impact resources and also integrating that into the health curriculum so that the health coordinators will also have those resources so that impacted school and impacted home can be used together by teachers and by parents. And so I'll end with this slide here to where this is my dream, this is my crazy dream for impact schools and impact homes. This was a classroom during the pandemic. They were still doing their activity breaks. They just modified it. They're doing it seated now. If you see, all the little kids have little masks on, so they're still doing their exercise. And then a parent sent me this picture right here where the kid was watching TV, doing his exercise. And so that's super exciting. And so one of the principals, when I was telling her about this, and we've been in her school for the last year, she said, kids are amazing, I tell you. They have gone through so many disappointments the past 2 years, and I believe that ours will come out with so much resilience because of the work your team is doing, so thank you. So I will tell you that yes, I am crazy, my students are crazy, and we fully own that. But Steve Jobs says the people who are crazy enough to think that they can change the world are the ones who actually do. So we may not be able to change the entire world, but our goal is to change the state of Michigan to provide 20 minutes of physical activity in the classroom, 20 minutes of physical activity at home, and then we've even started impacting your community to where we're getting community organizations to come together to offer more physical activity. If we're going to recommend that all kids get 60 minutes of physical activity, we believe it's our duty to actually provide those. The next step is to actually incentivize them to do it, but at least if there are free opportunities for all kids to engage in physical activity, that is our goal for the state of Michigan. And I think we have enough supports in play to actually make that happen. I've told Michigan Department of Education and Michigan Department of Health and Human Services, by 2030, I do not want to still be talking about physical inactivity. We can do this. We can make a dent. We can move the needle, and our children need us. So let's get moving. And so I want to just thank you for the invitation to speak today. I want to thank you for listening, and I think we have time for some questions, and I just want to acknowledge my funders for this.
Friends, spontaneous applause is a great thing. I was going to say, please join me in saying thank you to Dr. Hasson, but you're one step ahead of me. Dr. Braun has got a microphone, as do I. We are happy to be floaters, so as the hands go up, we have an opportunity to interact with a really exceptional scholar, and I think we should take advantage of it. And I see Michelle has quick draw McGraw.
Thank you. Good presentation. I enjoyed it. Of the kids that have the 99% that go back to focus, mine are the one that don't. But I have a question about focus. Is that just now with your studies limited to actually sitting back down quietly, or are there other measurements beyond that monitor what focus is?
So we are currently right now looking at academic outcomes too. So it's important to note that most changes in academics really happen as a change in fitness. So the acute bouts, you're going to see changes in attention. We've done this in the laboratory where you have them do a quick math test and see, okay, how it's grade level, how accurate were they able to complete the math test, and then how quickly were they able to complete the math test. And so we've seen improvements there. We have not done that in classroom because we don't want to be too disruptive in the classroom. But that is one of our outcomes that we want to look at moving forward. Right now, some of the outcomes that Lexi and her colleagues, they were doing it 4 times throughout the year. And it's similar, doing different math tests or doing different cognitive tests to see, is the physical activity helping, do we see changes over time throughout the year? The original one was just to see, because most of our research questions come from what the teachers say may be potential barriers. So they were nervous that the kids were not going to be settled, so we said, well, we can measure that. And so that's how we started looking at focus. But when we saw such great outcomes, we said, okay, we need to dig a little deeper in that. But we try not to overpromise to the teachers, because usually, again, it's about 2 or 3 years before you start seeing those standardized test scores increase with physical activity alone, just physical activity in the classroom alone. Great question, though.
Rebecca, if I may, a couple questions. You had mentioned 48 out of 50 states adopted your video program. I'm just curious about who the outliers were.
I didn't look. I should have probably looked, but I didn't look, yeah.
The follow-on is, do you have any interest in recapitulating this work in the state of Colorado by any chance?
Oh, people always say that to me. Yes, we always want to go national. One of my students said on one of the videos, we're going global. But we would really love to make sure, again, one, that we're not selling snake oil in Michigan, and actually see improvements in health before you start. A lot of people want to disseminate all over the place, but make sure that it's actually sustainable and working, and get the processes down so that you can give a model that can be disseminated to other states. I think too quickly people get excited and want to, take this here, take that there, we're talking to these funders here. And we really want to make sure, because even myself, this is very interdisciplinary work, and I'm very outside my wheelhouse. So we want to make sure other people who want to adopt the same thing, that we can give them processes to follow so they can see even better outcomes than we've been able to see.
Great. Thank you for that.
Thank you can you hear me?
Yes.
Thank you so much for your talk. First, I want to compliment you. Our college is very diverse. We have units that are from one end to another, and your talk was exceptional in being able to address, I think, components of all of our units. So thank you
You're welcome.
for that.
Yeah.
I guess, like Barry said, you did your homework well related to that. I'm Patty, and I'm from occupational therapy.
Oh, yeah.
And one of the slides that really attracted my attention was the zones of regulation.
Mm-hmm.
And in occupational therapy, we have several programs that are related a little bit more to sensory processing and kind of activity, but how is your engine? Is it low,
Yes.
medium, high? So I'm curious. We also have a zones of regulation, and I really liked the emotional component, whereas ours is the one that we use that's commercially available is more about sensory regulation, if you will. So I'm curious if you know of the zone of regulation I'm speaking of, and if the one you're using is adapted, or where you came up with that.
So that came from the teachers. So again, almost everything that we do, it comes from sitting and listening to the teachers and what are they doing. Penelope, the Ph.D. student that I'm working with now, she was very much interested in social emotional health. And so as we were talking with the teachers that, yes, we wanted to help you use physical activity, that's a strategy to help with classroom management. And they said, well, we're using zones of regulation, da, da, da. And so we went to go look that up. Well, what is this? I don't know what they're talking about. Once we looked it up, then we started working with other teachers in our little Impact at Home group, and we created a module to actually see, okay, what does the literature say about this? And is there information to help us understand, connect to what they were already doing, so that we could rapidly turn around a resource that, again, not only does the physical activity connect with their learning outcomes, but now it's also going to connect with their social emotional outcomes. We want to, again, the scientist in me is like, okay, what's the mechanism? Like, this is what the literature says, but there's not a lot of research in that area. And when I've given this similar talk to other folks, psychologists in South Carolina, they're like, yeah, I don't know, that's a good question. So I think that'll be an important dissertation for somebody in this audience. But great question.
Dr. Hasson, thank you so much for your presentation. Really enjoyed. I'm really interested in research in schools, so it was really good to hear talk about all the work you've been doing. Also, it seems really common sense that kids need to move, while we don't see it very often in practice. So thank you for that. It seemed to me that a lot of the baseline on your work is awareness especially of teachers and school of that need for movement. And I wonder if you measure how this impacted the recess time and recess opportunities.
Yeah.
Because when I look at this, to my angel side, the angel on my shoulder says, oh, this is great. They'll be more aware that they need more time in recess. And the devil side says, they might think we don't need recess as much because we're doing activity in the classroom.
Yeah, no, that's a great question. So there's actually a huge movement in Michigan right now. I'm part of this coalition that is actually going to legislators to ask for more funding in their budget so that to incentivize school districts across the state to not mandate, because nobody likes that word, that's a dirty word, right? But incentivize recess in school, 20 minutes of recess every single day. And so what's the capacity building for that? Because recess is also a very complex part of the school day, to where you need people on the ground, you need volunteers, you need safe practices. And so PlayWorks, which is a national organization, has been doing a lot of work in that area. We have not actually had many teachers that say either or. Teachers really want to do activity. I had a teacher tell me, this is the first time I feel like I have permission to do physical activity. And I said, well, what do you mean by that? And they said, well, I've always wanted to do it, and I try to sneak it in a couple of times, but because now this has been institutionalized in our school, I feel like now I have permission, because they feel like anything that deviates from the actual curriculum, that they are cheating their students. But with the rebranding of physical activity is helping to prime the brain for learning and giving them the science behind physical activity and cognition and brain function and brain development, they're like, oh, okay, So they would actually love to have much more physical activity in the school day. It's just they're restricted by the time constraints, they're restricted by the curriculum demands, and they're just restricted by student behavior too. They are very aware that this is not recess in the classroom. Because it needs to be very structured, that we're using this to prepare the brain for learning. Recess is free play, where they can, be creative and have fun and play games and learn a lot those are very different things, and I think teachers are aware of that, probably more so than we are, that the recess and classroom activity is different than PE. So this is not a replacement from PE. Sometimes we get a little pushback from PE teachers that they're nervous that this will replace PE because you need a certified PE teacher and that teachers aren't trained in that. And we say, no, this is part of the comprehensive school programming to where different schools have different opportunities to have all different types of physical activity. We're just focusing in on classroom activity break because we know we can hit all kids there. It's probably the most difficult parts, hence Don Quixote, but it is that classroom space time, I think, is a place where kids are sitting all the time, and the teachers want to do the activity. They just don't feel empowered or that they have the skill set to be able to do it effectively.
You're right in the middle, but I started moving faster.
You win.
Thank you. So you're talking a lot about mechanism and the importance of making sure that everything is implemented in a consistent way.
Mm-hmm.
In what way have you addressed or had to address the requests for different adaptations across all of the different places that you're implementing, especially possibly having, such a tailored program to begin with and then needing additional individualization? How have you navigated that across school or home settings and even in the community?
Yeah, so that's a great question because you need adaptations at all the different levels. So you need adaptations for the students because now you're talking about, helping students to have a tailored program to figure out where they are in terms of their emotional regulation and then getting to the point to where they can pick the different types of activities that they want. You have different classrooms or teachers that have different levels. Some teachers, they're half marathon runners. They do all kinds of activities, so they've totally bought in, whereas other teachers, they may have physical injuries. They may not be able to do physical activity, or they just have other barriers that they're dealing with. Then you have the schools, then you have the ISDs. So how we have dealt with that is, again, with the implementation science framework of really paying a lot of attention to that exploration phase. So figuring out what are the needs of that school, what are the needs of the classrooms, what are the needs of the teachers, and making sure that you hear from them. Like, is there anything in this school district that's going to help to sustain this? Talking to the PE teachers. So do they have buy-in for this? So the districts that we're in now, they're like, yes, please, bring in more physical activity. Versus other districts, they might be like, wait, are you taking my job? And so those are different strategies that you're going to have to work through before you even get to implementation. And so this is why we talk a lot about slow roll to where, again, that's hard concept sometimes for superintendents because they very much are like, we need this yesterday. Our kids are falling off the cliff. And we're like, yes, we recognize that. And so that's why we have the impacted home videos. So if teachers want to do it, we will give you the free resources. They're available to anyone. But if you want this program to be sustained for the long haul in your district, during your tenure and when you leave, because most superintendents are only there for like 4 or 5 years at the max, is 2 or 3 years at low resource schools. So if you want this to be a sustainable program, then let's do the work beforehand to see what are the adaptations. So we have made it to be a very flexible program to where the only mandate or requirement that we really ask for is let's get 20 minutes of physical activity. That the teacher, you can do it however you want. So we have one teacher who takes them out to the playground. And so she likes to do her activity. Go for it. Like, it's physical activity. Like, you all think about all these other crazy, I just want the kids to move. So if we think, so it's actually a very all these different pieces that we have developed. Some teachers, they don't like gamification because that's too much tracking that they have to do. And they don't want to track how many kids, but other teachers, they'll turn it into a lesson. So I think creating flexibility and giving teachers time to figure out what do they need to do. So if I wanted a structural change in schools, I would definitely think about restructuring the school day. to allow for more planning time. Teachers always ask for more planning time. They have very little time in their school day to actually sit down and collaborate and plan. But I think that that's essential for them to kind of troubleshoot together. How can I plan out? What am I going to do? What if I have a student who needs additional help? How am I going to weave them in? We had one student, long answer to a short question, I apologize. But we had one student who, for religious reasons, she could not participate in the physical activity at all. At all. Like, nope, their parents would not let her. So then what do? Just tell her to sit in the corner? No, we need to think of a plan of how can we keep her engaged so that you can build social cohesion in that classroom. So maybe now she becomes the, she gets to pick the activities. She's the timekeeper. She's the floor monitor. She's the safety monitor. She's doing something else that enables her. What happens when Johnny breaks his leg? And then, so are we just going to keep doing the same activity? And then, Johnny, you just do your one arm? Or is the whole class going to now just do upper body activities until Johnny gets out of his test? So some of our trainings are about adaptation, inclusion first, but adaptations. Like, what are those adaptations that we need to make? And how do we make sure that all kids feel included in that space? Because we know that physical activity can also be, people can have very negative experiences. So if you have a negative experience on the playground or in physical education, that will translate in the classroom as well. And so how do we make sure that it's not like, ooh, she's not doing it right, and there's no kidding, and that there are ground rules or guidelines that they have established that this is what we're trying to accomplish with our activity breaks. But very good question.
Right. Dean Youngblade has some final comments to impart, so let's thank Dr. Hasson for a fantastic talk.
So I'd like again to say thank you so much to you, Dr. Hasson, for spending time with us today, for your inspiring presentation. And I've been thinking about Patty's comment about the connections to all of the units in our college. And thank you for that crazy genius. But think about the crazy genius that we all embrace every day. We confront hairy, gnarly, big problems. And to solve any of them, it takes all of us, all of our thought processes. So let's hold that as a challenge as we go forward, and to continue that craziness, the genius in that craziness to solve these problems. So I'm going to ask you now to do two things. Let's move, stand up, and let's focus our gratitude to Dr. Hasson. Your transition times could use some work here. Okay, thank you. So funding for Dr. Hasson's talk was provided by the Mary Scott Lecture Series Fund. This series is made possible by a charitable trust endowed by Mary E. Scott to the College of Health and Human Sciences upon her death in 1984. Throughout her career as a social worker, Mary Scott was committed to improving the lives of those around her. And the purpose of this lecture series is to address a topic relevant to the lives of individuals and families. And we're so excited that you shared with us today your work. I'd also like to thank the college's Research Day Committee and others who've played key roles in the success of CHHS Research Day. We're going to recognize everyone individually at the awards reception a little bit later this afternoon. And I want to thank you all for attending today and for your very thoughtful questions. And I know there's more. I could see hands starting to go up, and so I wish we had more time to spend on this fascinating discussion. But after a short break, we're going to begin our faculty and Dean's Fellow Lightning Talks. So at 1:45, we'll be back in this room. We invite you to stay and learn more about the outstanding research and scholarship in the College of Health and Human Sciences. Thank you.